Good morning, all of you. So, we have studied in our previous class about the physical changes which is happening in old age. So, that can be taken as the biological aspects as well as the physical aspects of aging. So, question can come like that. Similarly, today we are going to see the other aspects of aging, like cognitive aspects, environmental aspects, as well as psychosocial aspects. So, first one, dealing with cognitive aspects of aging. So, what do you mean by cognition? So, cognition means the mental process of acquiring knowledge through the experience as well as through the thought as well as with the senses. So, that is all about acquiring knowledge as well as understanding. That is cognition. So, in addition to those physiological changes that occur with advancing age, older patients are also experiencing changes that have an effect on cognition. So, cognition taught commonly include these things. Cognition includes abilities related to memory, intelligence, orientation, judgment, calculation abilities, learning, attention, language, higher cognitive function, and constructional ability. So, in old age, as the age goes up, all these cognitive abilities will be affected. I think without telling this thing, you know the person will not be able to judge a thing, a situation. He can't take a decision in his life. Orientation will be lost. All those things. So these are the cognitive abilities which will be going down. So cognition mainly focuses on intake of information and storage, processing, and retrieval of stored information. So what is the main focus? The intake of information. How much the person will be able to able to give his attention for something, for any matter. So if someone is talking to a person or some important discussion is going on, how much an old age person can intake that particular information and how much he can store, he can process as well as he can retrieve the stored information. Retrieve means വീണ്ടെടുക്കൽ. So cognition is all about these things. So there are many factors which can affect cognition. So what all may be the factors? There may be diseases, any diseases. For example, Alzheimer's, all those things. Pain, it can be pain. It can be sleep deprivation. It can be medications. So one by one, sensory changes as well as diseases associated with age can cause misinterpretation of information being collected. So അൽഷിമേഴ്സ് ഉള്ള ആളുടെ അടുത്ത് നമ്മൾ സംസാരിക്കുമ്പോൾ കറക്റ്റായിട്ട് കയറില്ലല്ലോ ഇൻഫർമേഷൻ. നമ്മൾ എന്ത് പറഞ്ഞു കൊടുത്താലും വേറെ ഏതെങ്കിലും ആയിരിക്കും കേൾക്കുക. ഇഫ് ഡിസീസസ് ലൈക്ക് ഹിയറിംഗ് ലോസ് ആളുടെ അടുത്ത് പറഞ്ഞുകൊണ്ടിരുന്ന അയാൾ ചിലപ്പോൾ മിസ്ഇൻറ്റർപ്രറ്റ് ചെയ്യാം ആ ഇൻഫർമേഷൻ. സോ പെയിൻ, നല്ല പെയിനുള്ള സമയത്ത് ഇൻഫർമേഷൻ നമ്മൾ എന്തെങ്കിലും സംസാരിച്ചുകൊണ്ടിരിക്കുകയാണെങ്കിൽ എന്തെങ്കിലും മനസ്സിലാവും, നോർമലി തന്നെ പിടികിട്ടില്ല അപ്പോഴാണ്. So pain from chronic diseases such as arthritis can limit cognition as pain takes over the body and mind. Third one is sleep deprivation caused by worry or fear. That also can make it more difficult to perform routine tasks. So medications, of course, some medication can lead to drowsiness. So പറയുന്നതൊന്നും ചിലപ്പോൾ പെർസീവ് ചെയ്യാൻ അല്ലെങ്കിൽ റിസീവ് ചെയ്യാനായിട്ട് ഓൾഡ് ഏജ് പേഴ്സൺസിന് പറ്റില്ല. So that can lead to decreased or impaired cognition. So one by one, changes which is seen in mental functioning. So there will be decreased adaptation, coping with new situation, perception, comprehension, Comprehension means the capacity to understand something. Range of interest as well as understanding. All these things will be decreased. We can think that the old age people will lose their interest to do they will be lost to do any means there will not be any interest to do any type of activity. Even they would like to talk with others, they will be having anger, all those things. So that is about mental functioning. All these mental functioning will be decreased. So increased repetitive thoughts as well as vulnerability to stress. Repetitive ആയിട്ടുള്ള ചിന്തകൾ വരും അവർക്ക്. അതുകൊണ്ട് അവരെ ഉറക്കത്തെ തന്നെ ബാധിക്കും, ടെൻഷൻ കൂട്ടും, സ്ട്രെസ്. They are very vulnerable to stress. Changes in memory. So decreased number of neurons, blood supply to the brain. All these things will lead to short-term memory, which is mainly associated with decreased judgment, insight, ulkaicha, as well as orientation. So while comparing to the gradual as well as greater memory loss, so gradual memory loss can be seen during the 6th decade of life. 6th decade of life means the age group from 50 to 59, and 7th decade means 60 to 69. So we can see gradual memory loss in 6th decade and greater memory decline in mid 7th decade. So while comparing to the long-term memory and short-term memory, long-term memory retrieval is easier compared to short-term memory retrieval. So that is about memory. And next is about learning and intelligence. So aging process may affect learning. Of course it will affect learning. The person will lose interest to learn something. The person will be weak to listen to something. The person will be having comorbidity, of course. The person will be maybe taking a large amount of drugs that may interfere with their daily activity. So of course it will affect learning. So registration of information or reception of new stimuli. These are like textbook words. You can write by your own. So whatever the person is reading or whatever somebody is telling to the person, that may be affected through age-associated changes. So retrieval of information is slowed. So when we ask something to collect information, what to tell, that will be very slow. So that may be mainly influenced by the peripheral as well as central nervous system. So as a result of it, the person will be having hesitancy in answering questions or repeating information. They will not be having any interest to answer us. Okay. So intelligence, and main thing is intelligence does not decline as one ages if it is measured using an appropriate instrument. So appropriate instruments here mentioning that it should focus on accuracy. It should not focus on speed of response. So of course the person will be taking long time to respond, even it is accurate. So while we are assessing the person with appropriate instrument, the intelligence does not decline. Intelligence level will be normal. So but as we assess the intelligence with the same instruments which we are using to assess the adult, of course we will find the result that the intelligence is decreased. So that is the difference here.